Hello, my name's Dr. Tim Chapel, and this week on Medical Miracles we're going to talk about dentures, specifically what's new with dentures, new technology, and how they may be different from your grandparents' dentures. When someone comes to my office to have a denture made for the first time, they bring with them many questions. Often the question they lead with is, how long will I be without my teeth? In my practice, you'll never be without your teeth. The day your remaining teeth are removed, your denture is placed. I know in some offices and certainly in some clinics, it's usual to have the teeth removed, wait for a period of time, 6 to 8 weeks, and then have your denture made. In my office, we place them right away, and I take a fair amount of time to set these teeth myself and arrange them so when these teeth are removed, the teeth that go in look very natural. Another frequently asked question by people who are having dentures made for the first time is if they'll be comfortable, and yes, certainly they will be. We can even write a prescription for a medication that will help relieve their anxieties before the appointment. Most people will say after it was done that things went a lot better than they expected. So I try to help people relax and understand that we've done this many times before. I very simply ask them what it is about their current denture that they would like improved. If they could change anything about this, what would it be? Then I listen and I take notes. And I'll make sure that those areas are addressed when their new denture is made. Some people will emphasize aesthetics. They'd like their teeth a little bigger or smaller. They'd like them a little wider or a little longer. Maybe the denture that they're wearing, they didn't have much say in how it was put together. I take the time to select the tooth, to arrange the teeth, so that each person is satisfied with their smile and with their speech before it's processed. 3 requirements we always make sure are met are phonetics, aesthetics, and function. Some people really emphasize aesthetics, and some people are more interested in function. We make sure everybody speaks well before they go. New denture teeth will allow you to eat more things on the menu. And in some cases, if you don't have enough bridge to hold your denture very firmly, even a good, well-made denture will use implants to help secure the denture in place. At this point, your biting force increases by half again, and you can enjoy more things on the menu. People who have worn dentures most of their adult life often don't have a sufficient ridge in the mandible to hold their denture very stable. It will tend to move, to slip, and it is the most common complaint among denture wearers that their lower denture moves. Today, with new technology, we can place implants in the patient's lower mandible and then put attachments inside a denture to hold it securely in place. I'd like to show this to you for a second. This is an education model that shows 4 implants in place. That's all that shows is this gold button on top. Inside their lower denture are 4 attachments. When you put this denture in place over the implants, it snaps in place and is held in place very securely. Now the patient is able to take this out for cleaning and place it back in. And now this denture won't slip, so it won't be sore, you won't catch food underneath, and your biting force will increase by half again. You'll be able to enjoy new things on the menu again. And people who have these placed often tell me they wish they'd had it done years before, and quite often will refer their spouse in to have the same done. It is a great breakthrough in dentures. Actually, it's a medical miracle. Dentures of 20 to 30 years ago basically looked the same. The teeth were aligned in a straight line, very flat, and they were designed such that your lip wouldn't go over the teeth or even show very much of the tooth, because quite frankly, the teeth didn't look natural, the pink acrylic didn't look natural, and a lot of denture wearers basically hid their smile. Today, that's not the case. Today we have porcelain teeth that look like natural teeth, beautiful teeth. We have pink acrylic that looks like natural gum tissue, so now when you have a denture made, you can have a big, broad smile and feel very proud of your smile. What makes it different, what makes the aesthetics different from the older days to today is not only the teeth, but the time in setting the smile line. I like to personally arrange the front teeth so that the patient will accept a smile, will accept a speech, and we can have a result that is beautiful. I'll often ask people to bring in a picture of their teeth when they like their smile the best, and we work from that. But then when the patient comes in to take a look at their smile before we finalize the denture, we'll see that we can get results like this. When someone first comes to my office, we have a complimentary visit. It's about 20 minutes. I'll listen to the questions you have, I'll make some suggestions, and we'll see if indeed you would like to have new dentures made. I'll explain how it's done, and we'll set up appointments from there. Sometimes people need a second appointment if they're going to have a consultation on implants. Sometimes we're able to go ahead with conventional dentures and do just fine. But a lot of the questions are answered at the initial visit. There are no x-rays, there's nothing to fear. It's a very easy, informative appointment, and that's how we start the process. Well, please watch our next segment on the Medical Miracle, where we'll talk more about implants, because that's where the miracle is with technology in today's dentures. Today we've covered conventional dentures, how you meet the dentist, what you can expect for aesthetics, but the real magic is in what the implant can offer for function and comfort and chewing ability. Look forward to seeing you then. And I'm Dr. Tim Chapel, and thank you for joining us on Medical Miracles this week.